In medical school, every student learns the exact biology of a nerve ending or the mechanics of a heartbeat. But there is a second, unteachable layer, knowing how to stand with a grieving family and project a sense of absolute composure. On the 5th of Asad, 1405, the medical community lost a practitioner who had mastered both. Dr. Syed Ahmad Hossein Mozaffari passed away, leaving his 2 sons and a vast network of patients to navigate a world without his guidance. This was the reality for his career. Practicing medicine in Kabul meant treating patients while armored vehicles sat idling on civilian street corners. Growing up and working in a state of constant social friction forces a choice. You can succumb to the instability, or you can become the anchor that others lean on to find their footing. Dr. Mozaffari chose the latter. His reputation was built on 3 specific habits: a relentless pursuit of new information, a refusal to ignore public duty, and a quiet, consistent humility. That stability began in the Kart-Saki neighborhood of Kabul. Born in 1347, he entered a family with a long history in the National Assembly and a deep bench of medical specialists. In the Mozaffari household, education carried a specific expectation. You acquired knowledge to solve collective problems. He carried that logic through Ghazi High School and Kabul Medical University. As institutions around him struggled through periods of national collapse, he stayed focused on the curriculum, in labs that were often stripped of basic resources. He eventually took his training international, earning a master's in public health from Jodhpur University in India. This combined 2 different ways of thinking. He could diagnose a single patient's illness and simultaneously understand the logistics required to keep a whole city healthy. He applied those skills as the head of adult internal medicine and laboratory manager at the French Medical Institute for Mothers and Children. His clinical work reached into Jamhuriyat and Taban hospitals, where he became known for diagnostic work that was as meticulous as it was fast. For 2 years, he also directed the Bo Ali Rehab and Relief Network. He used that position to push medical teams into Afghanistan's most isolated regions, making sure a person's geography didn't dictate their access to a doctor. For him, a medical license was a social contract. He viewed the treatment of the vulnerable as a mandatory responsibility of the profession. That same sense of duty defined his role at home. Despite his list of professional titles, he was approachable and lacked any sense of self-importance. In times of family crisis, he was the person everyone called first. He had a way of listening that lowered the temperature in a room. He would wait for the initial panic to subside, then provide a clear, reasoned path forward. This ability to manage human anxiety alongside physical illness is what moved him into the category of a true healer. His final chapter involved a move to Germany, where he planned to continue his medical practice. Illness intervened, and his work ended there. While his time in Europe was brief, he had already spent many decades working to reduce the suffering of others in some of the world's most difficult conditions. He left his sons a living example of how to conduct oneself with dignity and professional integrity. His career shows that medical expertise is most effective when the doctor remembers the person behind the symptoms. Dr. Mozaffari stays in the memory of his community as a moral standard to follow. His name remains synonymous with the quiet, steady service of others.